Failure to provide quality and dignified care to everyone everywhere is healthcare's biggest cause of suffering and death. Around the world every day, failures in healthcare systems occur because of these gaps between how care should be delivered and how it actually happens in real practice. Since 2012, Ariadne Labs, which is a joint center for health systems innovation at Brigham and Women's Hospital and Harvard T.H. Chan School of Public Health, has been designing and implementing scalable, system-level solutions to close these gaps in healthcare. From developing checklists and conversation guides to fostering international collaborations and establishing global standards of measurement, our work has been accessed in more than 165 countries, touching hundreds of millions of lives. In the United States, the maternal mortality rate has been rising for decades. In fact, it's the only developed country that still has a rising rate of maternal mortality. People giving birth today are 50% more likely to die during childbirth than their own mothers were. And this is 3 to 4 times more likely if they are Native or Black. For every death, hundreds of thousands more people face avoidable suffering. People giving birth today are 300% more likely to experience severe injury and 500% more likely to receive a C-section without clear benefit to the person in labor or to the infant. When you look at some of the root causes of these system failures, communication comes up often. It's these failures in communication between providers and each other and between patients, which according to the Joint Commission, these failures are responsible for up to 90% of preventable injuries during childbirth. Dr. Neil Shah, an obstetrician and globally recognized expert in healthcare innovation, founded the Delivery Decisions Initiative at Ariadne Labs to tackle these gaps. The Delivery Decisions Initiative is a research and social impact program focused on transforming childbirth care around the world so that every person can start or grow their family with dignity. In 2017, the Delivery Decisions Initiative team collaborated with a community of patients, advocates, doulas, nurses, midwives, obstetricians, implementers, and researchers to design TeamBirth. In TeamBirth, it's a communication and teamwork process that closes these gaps in communication that challenge the safety and dignity of people giving birth. This is done by improving shared decision-making and putting the patient at the center of their care. TeamBirth has 2 main principles, the first being teamwork and the second simplicity. These principles are put into practice through 4 key behaviors that are critical to support effective shared decision-making, teamwork, and communication. The first being promoting each person's role on the team. The second is eliciting the patient's preferences and experiences. The third is clearly distinguishing between care plans for the patient, the baby, and for labor progress. And the fourth being setting clear expectations for the team. The goal is to empower all members of the care team, including the patient themselves, to play an active role in shared decision-making. The TeamBirth behaviors are supported by a series of team huddles and a shared planning board, which you'll see more in other videos. Additionally, there are shared decision-making tools, all of which will be discussed in further videos. TeamBirth care process was tested in a clinical trial at 4 hospitals in Massachusetts, Oklahoma, and Washington, involving hundreds of clinicians and tens of thousands of families. The trial showed that TeamBirth could be implemented in many different settings, in community hospitals on both coasts and in the heartland of the United States. 90% of clinicians said they would recommend TeamBirth. And patients in the trial also reported very positive experiences. 79% felt their preferences made a difference in the care that they received, and 87% felt that they had the role they wanted in decisions about their labor. 94% reported that their clinical team talked to them in a way that they could understand. And there was also a significant relationship between the number of huddles patients reported throughout their labor and the patient-reported acceptability, or those positive experience measures. This appeared to be suggestive of a potential dose response between number of huddles and positive experience. All people who give birth deserve to have a safe, dignified experience. TeamBirth is an evidence-based approach to turning this vision into a reality. If you're interested in implementing TeamBirth, please contact us at deliverydecisions@ariadnelabs.org.